Coming up next on Primary Care, faith and medicine. Medical professionals are taking a more serious look at the relationship between the two.
I don't believe in medicine. I trust the science, but I believe in God, and there's no contradiction in that.
Hello, and welcome to Primary Care. I'm your host, Dr. Lonnie Joe. Research shows that the majority of us use our faith to help cope with illness, and our faith can positively affect our physical and emotional well-being. Having a strong faith has been linked to improved immune function, lower death rates from cancer, less heart disease, lower blood pressure, less anxiety, and better health behaviors like smoking less, getting more exercise, and better sleep. However, there are some who believe that faith and medicine are worlds apart and could never coexist. But that is not the belief of my guest today. We're pleased to have with us Dr. Horace Smith. Dr. Smith is a pediatric hematologist and oncologist at Lurie Children's Hospital and the senior pastor of Apostolic Faith Church in Chicago. He is a firm believer that faith and medicine can and do coexist. Dr. Smith, welcome to the show.
Well, thank you, Dr. Joe.
How can someone have both faith in God and believe in the medicine and the science surrounding the medicine?
Well, those two worlds are not contradictory, contrary to most people's belief. I think that we have been erroneous. I ask people who have faith in God, I ask them, who is the author of science? We say God is the author of all knowledge. He's omniscient. If he is, then therefore our worlds, whether it's the physical world, whether it's the stars in the cosmos, they are so precise.
One source.
Because, God made them. So if they came from that source, then you said something about what we believe in. I don't believe in medicine. I trust the science, but I believe in God. And there's no contradiction in that. Sometimes there are questions, but not true contradictions.
Yeah, we've been led to believe that there is a contradiction with the universal conversation surrounding us. But you're correct, I agree. There is no contradiction. So what role can the church play in helping us address this issue?
Well, I think the church plays a key role and must play a better role. If you look at it, all the statistics about health disparities, especially among African Americans and so forth, most of whom are church people. It's because what we call faith sometimes really is either a lack of knowledge or fear. I use these very common analogies. People say to me all the time, well, I don't want to have an operation. I say to them, well, do you know somebody who wants to have an operation?
Right, absolutely.
No one wants to have an operation. The question is, do you need one? And if you do, then you must trust God, make the good decision about your surgeon and your physician and your anesthesiologist, all those things. So I think it's a matter of being informed correctly and then giving God the glory, making choices and decisions based on facts that God is the author of.
So recognizing the source. Nobody wants to run out of gas either. So that's why we find a station to fill up on.
There you go.
Right, great. So the church itself, the physical function of the church, do you recommend or do you suggest that churches find a way to have a health ministry?
Well, I think churches in this day and age must. I think the church, just in general, must become the center of culture for African Americans because it is the institution that is the longest lasting, the most resilient. It is the basis of our trust. People ask me about science and ask me about, my faith, being a doctor. I tell them that both those professions are based on trust. Why do people come to my church? They trust me. Why do people come to my clinic? They trust me. So if there's an institution that really understands is the position of trust, then people trust what's coming from that pulpit. So if my physical health is important, and it is, then that minister needs to understand to be holistic. They must speak to the body, the mind, the spirit, and all the things that impact your life. So I think in this day and age, you must have an effective health ministry, not someone who we call nurses who are not trained and they're to wipe the pastor's brow.
It's not an elective, it's a requirement.
I think it really is a requirement. I think in this day and age, the position of the church has to be stronger in affecting people's lives in a positive way in every aspect.
So what does a church ministry within a church What kind of elements should it contain? What does it look like?
Well, I think it looks like any other place that is comprehensive. I'm not saying the church should do comprehensive health. I'm not saying they should do it, but they should be the source of where people can get knowledge about it. So I think that the church can do things like basic screenings, sometimes like blood pressure, things like that. But we do in our church, we have regular seminars, workshops on your health. And we outline in particular, the core benefits of healthcare, and then we have recommendations where you should go to be seen and how often and so forth. And I think that the church, again, because it can influence people's decisions, they don't have to do the work. They should be the source of direction for the work.
Sort of like a lamppost, shine some light
There you go.
on the issue and provide some direction, which is a mission in itself.
Yeah, and some churches like our church, we feel we're called also to do community health. So a part of our plan in our development of building churches and building academic centers, we are also in the mindset of building, outpatient clinics in areas where people can know that faith is honored in this setting. And I think that helps people also to be more compliant with their health care because they understand that God is not negated, he is honored, but good science is the background of it.
Right. From a historical perspective, the hospital was born out of the back door of the church, so to speak.
Yes.
And
The church is always in every society has been really the initiator of health. Whether you go back to the Egyptian culture or you go back to any of the ancient cultures in South America, in Africa, again, the church, the faith-based community, is a purveyor really of health. It's just been in the Western Americanized society that we've almost disenfranchised us from that connection of faith with health and health science.
so your program, who's responsible for it? Give us some idea what the lineup looks like.
Yeah, Apostolic Faith Church, we've got doctors, nurses, pharmacists, people in healthcare who volunteer to run our programs. And those programs, again, try to have a wide range of choices for people, but also on special occasions. Father's Day, most of that service is designed to have men talk about their health in partnership with one another. We have a whole list of know your numbers. What is your PSA number? When was your last colonoscopy? When have you last had your blood pressure checked? What is your LDL? What's your HDL? These things to us are really important. With women, their mammograms, all these things that we think the church should be saying to people. This is an ongoing commitment so that I think we are comprehensive in the scope of it as far as the subject matter, and then we farm it out to the proper people.
And of course, the leadership is right in the forefront of all of this.
Well, if it isn't, it's not going to be effective. In our churches, any program that the senior leadership is not just talking about, but doing, and a little bit of my personal story, people have noted who know me, I've lost about 35 pounds in the last 2 years. And that's because my wife bought me about a year and a half ago a Fitbit. When she bought it, I said to her, "What's that?" She said, "It's a Fitbit." I said, "What's it?" I didn't know what a Fitbit was. But she told me about it, and I said, "You know what? I want to be fit." So I started using a Fitbit, not to lose weight, but really to get active. And it really got my attention. I walk now on average of 9 miles a day, every day. And so here's an example. Last year was my 35th pastoral anniversary. On my anniversary, we give away presents to our church members. So my wife and I bought 2,000 pedometers and gave them away as the present for our pastoral anniversary. As of right now, about 1,000 of those people are still using their pedometer to walk with us. So that, we incorporated fitness and health in a meaningful way in our own lives to say, we don't only talk the talk, we walk the walk. Because if you're not doing it, people learn in churches very quickly what's being said and what's being done. If what's being said is not being done, they don't do it.
How about that? So a man or woman thinketh.
So is he.
Good. We have to go to a break. We're going to take a short break right now. When we come back, you'll hear more from a woman whose cancer diagnosis helped grow her faith and the understanding of medicine.
Question: what will you find on all over-the-counter or OTC medicine packages to help you choose the right drug and use it safely? The answer: the drug facts label. This label lists the medicine's active ingredients and purpose, how much to take, and warnings you should know before using it. Remember, even OTC medicines you buy without a prescription can cause side effects you don't want. So follow the information listed on the drug facts label. For more information, visit fda.gov/drug facts label. A message from the U.S. Food and Drug Administration.
Welcome back. Shirley Robeson is a brave and courageous woman whose faith has grown stronger over the years after the diagnosis of stage 4 breast cancer. Shirley is a member of Word of Faith Ministry and will be the first to tell you that her faith is in God and sees science and medicine as God's gift to help us take care of each other.
The knowledge that God loves me, that it's His power that is keeping me. At one point, they were very concerned, and it was last year, that they had given me all the chemos that they thought were available, and they had nothing left. And they were looking pretty downtrodden. But I told them I'm not going anywhere. I knew this because I just feel that when God is ready, He'll let me know. I'll know before they do. And I felt, no, this isn't it. And I prayed about it, and a lot of other people prayed. My church is praying, and I can feel it. I can feel the strength of other people praying. And I know that that's the major thing that keeps me on the planet. Once I was at a conference, and these people who have METs or metastatic disease, which is cancer that is not going to be cured, this lady had lived an additional 14 years. So when I asked her, how did you do this? She said, it's staying alive to the next medication, being able to do that. And I thought, oh, that was something I never thought about. So this medication that I'm on now, it wasn't around 3 years ago. I mean, it was still in the testing stage, but it wasn't available. But when I needed it, God made it available. So I'm using it now, and it's really working. Now, I believe, and I've been asked this, well, what's going to happen when that one stops working? Because all these medicines stop working. And I was thinking about it one day. I had to visit a doctor, and before I can even ask him, he actually volunteered. He says, I have a plan B. And I loved it. And I'm like, yay, a doctor with a plan B. Good going. So he says, if this ever stops, I have a plan B up my sleeve, but who knows what'll be out there at that point, or whether I'll even need it, because I do believe that God is going to heal me. And I've gotten better. I haven't gotten worse. I've gotten a lot better. When people ask me, aren't you afraid? I mean, every day, you never know. And the answer is no, because I know that it's going to be a transition. It's not an end that I'm headed towards. So what it has done, that is the diagnosis and the illness itself, has given me a freedom that I didn't have before to be me and to know that the power is with me. And I can shout sometimes when I think of, oh, I'm so glad He let me know Him. I'm so glad that I have something in addition to the medicine that keeps me strong.
Dr. Smith, you did a video called And God Made Man that some say epitomizes the intersection of faith and science.
Well, that video was trying to do just that, put in perspective, again, the wonder of creation. I use God as a creator. And I looked at the intersection between the stars, the cosmos, and how precise they are. And I used a quote from Augustine that simply says that we wonder at the heights of mountains, at the vast expanse of the ocean, and so forth, but we pass by ourselves without wondering. If you look at the human body, I mean, it is so precise, it is complex, and yet it's simple. It shows that there's a creative author who put us together, even with contingencies of illness and so forth, and your immune systems and so forth. So the interplay of that shows that God has purposely made us wonderfully made. But then the question becomes, how do we appreciate, first of all, and then care for those structures we call the human body? So it gives God glory, but also says you need to see your doctor as well.
Being a pediatric oncologist, do you find that children gravitate toward a faith type of approach to their illnesses also?
Well, I'm not sure about that. I think that children, and the difference in oncology with children and adults is just the difference between adults and children. Children trust. If you tell your son, I'm going to buy you, a new bicycle, you could lose your job today and be incapacitated, but on Christmas Day, he expects that cycle to be there. He believes in you. So the kids, I think, have always, trusted their physicians. And I think with us, there is a close relationship of trust so that, again, kids teach us how to walk in faith sometimes. They trust what we tell them. So I think that faith to them is trusting those that they have put their lives in their hands, and that we have to deal with them in a way that justifies their trust.
I think that a lot of my colleagues would do a much better job in this whole practice of medicine arena if they had more of a spiritual side to what they do. Do you find that to be a problem in terms of dealing in the broader medical community?
Yes and no. I've been blessed to be in medicine in 1975, and so I can tell you that things have shifted somewhat. We understand now that there is a part of us that's not simply biologic, not simply mechanical. There's a real side that is more ethereal, and sometimes my colleagues may not call that God. They'll say things like, well, that happened because we don't understand it. It's not in our hands, it's somebody else's hands. So again, I think that people are beginning to understand as you learn science more in depth, you realize that what we thought before was simplistic is not. I use an example of when HIV was really on the forefront, and I was a pediatric hematologist taking care of kids with hemophilia who got HIV and were dying because of it. The disturbing part there is that there was no cure. First of all, we didn't know what HIV was. Then we understood what it was. We could diagnose it, but no treatment. Then we developed therapies for it. But the background of that was that because of that devastating whole viral thing, we learned about T and B cells. They are able to mutate and take the place of other cells. We didn't know that before. Then we realized, wait a minute, how do they know to do that? How do your T cells become low enough for your B cells now to say, I used to be a B cell making hormone, now I can become a T cell? Well, clearly an author, somebody put that there, well, I call him God. And so I think that we're beginning to see as we get into the depth of science, boy, these things are miraculous, and they really are. So whether you call it an unknown thing or a deity, I call it God. And I think my colleagues, some of them are coming alongside saying it helps them to relate to their patients on a spiritual side along with their great medical side.
Right, it's an area that they embrace, whether they did before or not.
Exactly. I think that we are evolving to understand that because, studies have shown that people who have the same operation, the same diagnosis, but have a faith in God, clearly overall in general do better than people that don't. And those same people really want their physicians to relate to them even on their spiritual side and at least have a discussion about what they believe. It gives them more confidence in the physician.
How do you handle one of the most difficult situations I've been in as a physician? A person's religious belief is opposed or in opposition to what you're recommending for them.
That's difficult. I've had that too many times because, I deal with blood and transfusions, and certain religions don't believe in transfusions. And we try to respect every religion. One thing I think is important for a health practitioner is to respect the religion of your patient. Not to try to convert them, but to respect their religion. But there comes a real problem when you think that child, that patient, can benefit from a therapy, clearly can save their life, and somebody else might say, well, we don't believe in that. And a few times I've had to go to the point of having to legally take temporary custody to get a child to get treated with whether it's chemotherapy or a transfusion, which we believe would save their life, and then relinquish that back to the parent. But it's difficult because you want to respect every religion.
Very good. We're going to take a short break. Stay with us. We'll be right back.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
Welcome back. We're here with Dr. Horace Smith, pastor of Apostolic Faith Church and pediatric hematologist and oncologist. Dr. Smith, as you know well, depression is quite common amongst pastors, and many suffer in silence because they think there's something wrong with them spiritually. Even some of the parishioners don't really address this situation of depression properly. How do you get them to understand as leaders of flocks? How do you get them to understand and address this depression situation that we face?
Yes, and again, depression is a broad word. I think that the profession of being a pastor of itself is dangerous, because I think our culture almost demands something that's impossible, and that is for people to be pastors, but not to be people. So you're not allowed to be discouraged, depressed, whatever, and the culture almost drives you to a point where I'm not surprised that the statistics will tell you that burnout and depression is high among senior pastors, because the culture almost pushes that and causes that to happen.
Is that because of the high expectations?
We were talking about this earlier, high expectations and very little control. We're in a business in the church, and it is a business where expectations are always very high. You're competing whether you like it or not, and yet you don't control many of the outcomes. So it's a very, I think, dangerous profession. You must be called to it, you must be trained for it, and hopefully have a church that allows you to be a real person so that you can handle the day-to-day pressures of being a pastor.
My father was a pastor for almost 40 years, and I used to watch him go from a court hearing for a member's son on a Friday to a funeral on Saturday morning, a wedding on Sunday afternoon, and 2 sermons on Sunday morning. I mean, the highs and lows of all those, and a christening, behind that, in a short period of time, has to be a roller coaster that pastors find themselves on that actually could be problematic, and I've never heard it described as dangerous before by a pastor.
It is dangerous, and what I mean by that is that we have to augment our training and our culture to really look at, I think, the psychological and spiritual that we sometimes put together. They belong together, and yet they have to be understood. Knowing God and having faith in God does not negate the fact that I have a personality. I'm a person. I asked somebody this recently, one of my pastors. I said, we say the pastor is the shepherd, and he or she is. But here's the real question: is the pastor not a sheep? So if there are sheep needs that are really important, we as pastors say, we go as your father from pillar to post to get all these things that happen for people because they have needs. Well, when you become a pastor, those needs stop. No, they don't. They are covered up, they're camouflaged. And so I think that, again, they put us in situations that we should not be. And then even ourselves, we don't have systems that allow pastors to have real support, to even have real friends. And so I encourage my pastors, you have to know people outside your congregation that you can trust. You must have somebody to talk things through with, a good mentor, somebody that's been down the road enough times to help you through these situations. And if you don't, the stress and the tension can be devastating.
I got about 100 more questions for you, but touch on a little bit the state of the so-called black church right now, especially this post-election era that we just went through and still are going through, and where we see the economics for parishioners and the health care that seems to escape us sitting in the pews. Where are we at as a community? Where's the church community at in terms of addressing some of these larger problems?
Well, I think, again, we say the black church, and we all know it's not monolithic, it's diverse. Having said that, I think that the church, because of its place in our society and in our culture, has to take on a broader responsibility and yet be more specific in things that you have mentioned. The whole issue of education, job training, preparation early on. I think the key is that even though we have to address what's happening currently, politically and socially and all those things, we've got to get a better handle on our young people. We must provide the environment of academia, rigorous training, understanding their role back to society early on so that we have leaders that are acclimated to this 21st century mindset. And if we don't, I think that the church will not be very relevant. I think we have to take on a broader role, yet a more specific role in this society.
Helping people understand the lifelong commitment.
It really is lifelong. I think anything that we're in, we must become the best, especially as African Americans. I think that we have in America seen, and excuse me for saying this, we've seen over the last 20, 30 years, the dumbing of America. I told my church, I will not dumb down the gospel. I will not lower the standard. I will raise it, because we're competing globally now. Our kids must be prepared at the highest level. We must demand that, expect that, and we'll have that. We have in our church a scholarship program for the last 25 years. We give away at least $100,000 every year in undergrad scholarships. Last year, for the first time, from Inglewood, a very depressed neighborhood, we had a young lady who was a Rhodes Scholar. She just finished at Oxford. It means our kids have tremendous potential, but we have not challenged them enough and prepared them for their opportunities. We must do a better job.
Dr. Smith, thank you so much. It's been exciting. Thank you for joining us on Primary Care.
Well,
We'll
thank
do this
you.
again.
I've enjoyed it.
Great. My guest has been Dr. Horace Smith, pediatric hematologist and pastor of Apostolic Faith Church. For Primary Care, I'm Dr. Lonnie Joe. Thank you for watching. For more information about the show and our guests, visit our website at primarycare-tv.com and continue the conversation on Facebook and Twitter.